recently had the honor of teaching dyadic developmental psychotherapy to an OT, an occupational therapy practice, where therapists are working with kids who have occupational therapy needs. And we talked a lot about the interface between a child having an organic problem, like they might have problems with sensory issues or ADHD, and it turns into a relational problem with a parent at home or with a whole family system. And that all professionals need to be mindful and really equipped with thinking about how the relational issues at home they're exacerbating or they're playing into the behavior issues that are originally organic, but now when the child turns maybe 3, 4, or 5, they are now behaviors that are affected by and playing off of relational issues. So, for example, if a child has something like a vestibular difference, which means that they feel gravity differently. This is one of our senses. It comes from our inner ear and has the capacity for showing us where we are in space and keeping our balance in a good way. So some children are born with differences in their vestibular system. So they may end up being kids who push into you just to see where you are and lean into you, or they might fall on the ground, or they might try to go upside down and hang from the chair instead of sitting at the dinner table. So those are just needs that the child has for being able to test out and feel their balance, their vestibular system. And the parents might not understand it as a nervous system need, a body need, and they might think, okay, well, when the baby is 8 or 10 months old or a year and a half or 2, that's understandable. But now that you're 4 or 5, you should sit up in your chair and you shouldn't hang over the chair and be upside down and need to have your legs up in the air. Especially if there's a younger child who's acting a lot more mature at the dinner table. Okay, that's when the parents start telling themselves, what's wrong with this kid? You have to sit up. And you're doing it on purpose in order to disrupt the family and get more attention. So what happens is the parent gives the child negative messages that your need or your behavior is inappropriate and that you're doing it on purpose, that you can control it, and that you should be different. And the problem turns into, from an organic problem, just a need. It's not even a problem, it's just a need for them to feel their body differently in space. It becomes a relational issue when the parent says you're doing it on purpose in order to annoy and disrupt the family. And then the child starts to think, internalizes, oh, I am a bad kid. I'm doing this on purpose. I have a motive of trying to disrupt the family. And that's what we need to really slow down and keep an eye on. What are we telling our children about their behavior as that we're giving them perhaps a message that they're doing it on purpose?